I would like to go back to the 526EZ form that goes about listen to your disability conditions that you have. You have what they call the primary condition, and you have a diagnosis. Say, for instance, you have a knee problem. You have conditions that are secondary to your knee. It could go all the way to your hip, down to the bottom of your feet, to your back, your shoulders, your neck, because it's all interconnected and it could be secondary. So this is very, very important for the veteran. When they come in to see me the first time, I usually tell them to write down what type of conditions they have so that I can actually help them go into more detail of what they have. Also, we're talking about different type of treatments. The different types of treatments is you have chiropractic care, you have physical therapy, because most doctors recommend, especially with knee conditions and all the other secondary conditions to your knees, they ask you to go to physical therapy, which is very, very good. Now, the medications you get are very, very important because sometimes the medications they give you have side effects. Now you say, why would a doctor give you medication with side effects? Is because they're trying to help with that particular problem that you're having or your disability, like if you have knee problems. They have different types of formulations that they give you, different types of strengths. They can give you the weakest strength or they can give you the highest strength on the medications and side effects. The limitations due to physical condition and injury. What are the limitations you can't do? Can you bend? Can you stoop? Are you able to bend over and touch your toes? I call it the daily routine active duty stuff you have. I call it normal routine daily activity. That's what I call it, the NRDA, is what affects you on a daily routine, I can't think of my word there for a second there.
The daily routine.
Daily routines, okay? I'd like to get into secondary conditions now. Again, you say, well, a lot of times you have bad knees. You'll say, why do I have a possibility, can I have a secondary condition from my knee down to my ankles to my feet? Because they're all centrally located and they can be secondary to the knee. Service connection can also develop into secondary conditions that can be compensated. You can get 10 or 20% for your knees, but you also can get, with secondary conditions, you can get an extra increase possibility, depends on how severe your condition is, because it goes by case basis.
That's true.
So what you want to do is make sure you get medical doctor documentation. A lot of times, a lot of veterans come in, they haven't been able to see a doctor for 4 or 5 years. And you sometimes wonder what the VA's going to think when they get this information. Why haven't you been to the doctor? The VA is the closest place. We are very, very strong components with the DAV that we always recommend that every veteran go and register at the VA hospital and get a primary care doctor. It's very, very important, especially if they don't have insurance. Because once you go over there and register with your DD-214 and your other documentation that you need to get into the system, and then you basically tell them how severe your condition is, and then they will assign you a VA doctor. You do not have to be service connected to go to the VA hospital. However, having a primary care doctor over at the VA Medical Center in Hampton or whatever, we got Salem and you also got Richmond, then you basically have a hospital that has a doctor that you can go and see.
Yes. Important information. As far as like medications, the doctors will tell you about your medication and give you the special instructions for the side effects. So they tell you if you're experiencing any of these side effects, please let them know. Come back to the VA hospital, go to the nearest hospital for treatment. And these side effects, it could be fatigue, weight gain, depression, anxiety.
Oh, definitely, definitely.
Even suicidal thoughts that go to severe, even to other physical conditions. You need to report these to your doctors. These side effects can have severe
Detrimental. They can be very detrimental to your.
These all need to be documented, treated. And the faster you document it and you seek treatment, the faster you can be helped.
I have a question. How about keywords and phrases when you document your as you try to get your disability?
Basically put down how severe it is, how chronic it is. It depends on, each claim, Lisa's claim is different than my claim. Her PTSD or her sexual harassment or sexual assault, we also have a form on that. I'll describe that to you later in this broadcast. Oh, I guess I can do it now since Lisa's already handed it to me.
After you finish this on this one.
Okay. What you want to do is basically, just lost my train of thought, Lisa.
Your individual case is different from mine.
Yes, each individual case is different because whatever affects you, whatever your pain is, mine it could be different. My pain threshold could be different than Lisa's.
Exactly. The pain tolerance levels, his height compared to my height, his body build compared to mine. And he could have a back problem, a pinched nerve. But because his tolerance, you might not be able to tell. But unless you listen to him and you understand his conditions.
Okay. So that goes back when you go to the VA hospital. Normally they ask you the world famous question: how severe is your pain on a scale of 1 to 10?
Yep.
So how do you answer that question?
That depends on each case. I mean, I ask them at their worst case scenario. Because right now, my knee pain can be a 1. But on my worst case scenario, on my worst days without medication, it could be a 9 or a 10. So I mean, the biggest thing you have to worry about is how often does that happen during the week? Does it happen 4 or 5 times a day? Does it happen 4 or 5 times a week? Does it happen 2 hours a day? Because that's what the doctors want to hear, and they want to be able to observe your pain.
Consistency.
Thank you, Lisa. The consistency of the diagnosis.